In South Korea, health workers are taking extra precautions with those suspected of having MERS, the Middle East respiratory virus. Most people who get the virus have had close contact with someone who had the disease. The symptoms of MERS are similar to those of the flu, but MERS affects the lungs. Dr. Bruce Merchant spoke via Skype.
The difference is that instead of staying sick for several days and then getting better, as most people do with flu, with this MERS-CoV, if they go far enough to develop pneumonia, then they are in dire straits, and somewhere between 20 and 40% of people do not survive.
In South Korea, the recovery rate seems to be higher. Still, the only treatment available is reducing the fever and other symptoms.
South Korea is an advanced, industrialized country with a very well-developed healthcare system, and they obviously caught this situation early on and have taken very decisive steps.
Some of those steps include sanitizing buses and taking children's temperatures at schools which have reopened. MERS first emerged 3 years ago in the Middle East, where the virus has caused the majority of deaths so far. More than 1,000 people have been infected, and the virus has killed nearly 500 of them. Anyone can get MERS, but those most susceptible and most at risk of dying are the very young, the elderly, and those whose immune systems are not robust enough to fight off the disease. Dr. Keiji Fukuda of the World Health Organization offered some hope for an end to the outbreak.
We do not see any changes that appear to have made the virus itself more transmissible.
The World Health Organization says new cases are already falling in South Korea, and it expects the MERS virus to be contained there by July. But experts say the only way to truly control the MERS virus is to control it in the Middle East, where it is still spreading. If the virus breaks out in a country with a poor healthcare system, like Ebola did, it will take much longer to contain. Carol Pearson, VOA News, Washington.